Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nirav, Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
All right. Welcome, everyone, to our UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown. Today, coming off a huge weekend in Bay Area sports with the return of Klay Thompson and Jimmy G battling through a thumb injury and leading the 49ers to victory. I'm sure a lot of people have questions about how athletes return to play, both from acute and chronic injuries. So maybe I'll open up with you, Brian, for the first question. It was reported that Jimmy G suffered a injury to the thumb ulnar collateral ligament. Can you talk a little bit more about what's injured in that type of particular injury, particularly when there's bone involved, the ligaments torn, and how quarterbacks can actually play through this type of injury?
Yeah, it's nice to see that the lights finally turned on where you're operating today. That gives everybody great confidence. So your ulnar collateral ligament is the ligament that keeps your thumb from bending out too far. So it's a common injury for baseball players from sliding into bases. It's a common injury for football players just because they get their thumbs stuck in so many different positions. When the UCL or ulnar collateral ligament of the thumb gets injured, it can get injured in a few different ways. One, it can get sprained, which can go through different levels of gradations. A mild sprain, there's just some inflammation in it, but there's no real loosening. A more severe one, the entire tendon or the entire ligament itself can rupture and the thumb can feel very loose. Sometimes a little fleck of bone can come off with that injury. That usually comes off at the base of the thumb. And it really depends on how far away that bone is from the rest of the bone and whether or not that's going to lead to a stable injury. So without actually seeing the x-rays, the assumption is that when they got x-rays on Jimmy Garoppolo, there was a small fleck of bone. It's not too far away from where it belongs because he has some inherent stability to his thumb. And then he's able to grab the football enough to throw, I would say, honestly, no different than he usually throws, which is mostly on target, a little bit behind Debo and Brendan Ayuk when they go across the middle. But if you look at one of his passes that was intercepted by Jalen Ramsey, it did look like he just didn't get a good grip on the ball. And that's the kind of thing that you can expect when people can't use their ulnar collateral as well as possible. You know, one of the things that before I did ortho, I always envisioned when there was a broken bone, it was just floating in space. And that it could go anywhere. And the reality is as soon as you break a bone, you bleed in the area. There's a scar tissue forms immediately. So I think for Jimmy G, it's not whether or not he's going to cause long-term injury. It's more whether or not he can play through the pain and he can play at the level he needs to play.
Yeah, I think one of the key things is how stable that thumb feels. So, as you mentioned with an X-ray or MRI, they can always show, a severe injury, but at the end of the day, it's about function. And if that thumb is stable and he can grip a ball, it doesn't necessarily matter what an X-ray or MRI shows, even though, we have predictions of what that may potentially do for an athlete like Drew Brees who needed surgery for a similar injury. Every player is individually different. And kind of in that line, Drew, what goes into kind of clearing a player, with an injury like this, whether it be on the sideline, how do you differentiate out? Is this pain? Is this functional? Is it going to cause more damage, particularly like in the game? And then maybe in the weeks, the week leading up to a game for someone like Jimmy G.
Yeah. And a lot of the initial decision, it's based on like how stable the joint or the injury is. So that's, us doing our physical exam and seeing, is the thumb, more lax than it should be to where there's not stability, of that joint, or like is the knee unstable, things like that. And then looking at the strength that the player has, and then looking at, how they're able to, control that body part. So if they're able, if they're able to have full strength, have good control, there's not increased instability, then we're a lot more comfortable with letting them play. And if it is unstable, there's always that risk that they do more damage to that area if they keep playing. And I think that's one of the biggest concerns that we have, especially in those weeks leading up to the game. So like when you're having that discussion of should I play, should I not, one of the big parts is what kind of risk is there both in the short term and the long term? Like, are you taking a small injury that has a predictable recovery in a week or 2 weeks and turning it into something that, may need surgery, may put you out for a year? And it's worth, taking that week off for a predictable recovery versus, turning it into a much bigger injury. And then I think, there's also that possibility of, potentially favoring that body part. So especially with something like the knee or the ankle, where, maybe you favor that and now you put yourself at risk for a shoulder injury, a head injury, other knee injury, something like that, where you're taking a minor, mild injury, but then you're not able to protect yourself and then you hurt something else as a result. So I think, those are some of the big things that, we'll look at in getting somebody back to play with an injury.
Yep. And, a question for you, Brian. One of the things that, Jimmy Garoppolo talked about during the week was that he felt like, something was burning in the web space where the ulnar collateral ligament was in his hand. And then after the game, I think there was a quote that said he got something to help with pain. What are the things, when you covered, some professional teams in fellowship, and maybe Drew can chime in as well, too, that athletes can get to help control pain? Like, what exactly are they doing? And is that something that you typically recommend for your weekend warriors?
Yeah, so piggybacking on what Drew was talking about, I think the difference between letting somebody with a partial injury or a bony injury to the ulnar collateral, you can inject them with numbing medicine, which famously has been done to Steve Young, best quarterback ever, when he had rib injuries and he had rib fractures. Unfortunately, a lung was punctured last year in the NFL, so it's not benign. But you can get a injection of local anesthesia. So if the thumb is stable, then it just doesn't hurt that much. The problem is that can then cause some of the sensation to the tip of your thumb to go numb, and you may still not have the same control. You can get a injection of anti-inflammatory, like a steroid, which probably isn't going to be used as commonly in the acute injury setting. Or you can take anti-inflammatories. And the reality is that the best way to control pain, especially for people that don't have a professional game on the line, is to consistently take anti-inflammatories, because that's going to increase the amount of pain, decrease the amount of pain by decreasing the amount of inflammation. So Nirav, when we talk about professional athletes and weekend warriors and adults, how does this different to how you counsel a youth athlete? Let's say they come to your office and they've had an injury 1 week before they really want to play in another game. Does your mind shift change? Like, let's say you were covering professional soccer versus youth soccer. How does that change your decision-making process and your counseling?
Yeah, no, definitely less aggressive with kids. And I think what ends up happening in the office is a lot of parents, coaches, even the athletes themselves want to have a professional sports mindset to their kids. Can you give the kid a numbing injection to get rid of their pain? Can you make sure he's cleared so that he can play? It's a big game for the high school or the club team. And I think particularly with kids, they're still growing. There's a lot of risks to them playing through the pain. I think in general, I tell my youth athletes in particular, if you have pain, that's your body's way of telling you that you shouldn't be playing. And you're not getting paid to play at this point. And as much as parents and coaches feel that this one game is going to be what pulls them over the top, I always tell them that if you're injured and no one's going to sign you, to play collegiately, you're not going to get to the next level. It's about staying healthy. And I've seen so many careers derailed because kids play through pain and then play injured. So number one, when these youth athletes come in, I tell them, look, you have to take extra amount of time to come in. The vast majority of you are not going to be playing collegiate or professional sports, but you don't want to have an injury to your knee or to your shoulder or to your elbow that then suddenly carries into your adulthood and prevents you from working out. So absolutely, I try to keep that professional sports mindset away from the youth athletes, particularly in my clinic.
Yeah, so hopefully the Niners win next week against Dallas and Garoppolo gets to continue this season, and Aaron Rodgers can experience COVID toe sometime against the Niners at the end of the season. So transitioning to Klay Thompson. So very different story. So Klay, depending on what you read or look at, took forever to come back. So he had his ACL injury in the playoffs a couple of years ago, pre-COVID. Came back from that and then tore his Achilles before he actually got back on the field, had surgery for both of these, and now is finally returning. Came back literally almost 2.5 years later, played 20 minutes, got the first basket against the Cavaliers, 17 points. So not a bad start. So Drew, is this a miracle? He had 2 major injuries. Or is this something that was expected that he should be able to make it back?
I would put it somewhere in between. It's a lot to recover from. Like, both of those injuries in isolation could be career-ending, career-altering. And then to have them just, one after another, like as soon as he's close to coming back, to just be, knocked back down with the Achilles. I'd say not quite a miracle, but like really, really impressive for him to come back. And I don't know if you guys heard him talking after the game last night, but he was saying, like, during his rehab, he was questioning, like, would he still have the same pop? Would he still have the same ability? And like, just to have to go through that for 2 straight years of rehab is really a lot. And so definitely impressive for him to, be able to come back and make it back.
Yeah, I think one thing people forget is you're 2 years older. Like, there is a difference between being 31 and 33. And it doesn't seem like a lot, especially if you're 47. It's like, I remember back then. But if you're a professional athlete, each year you get older, everything gets a little bit harder. So hopefully, I mean, it obviously looks like the training staff and medical staff did an amazing job getting him back. And hopefully this helps continue to relieve Steph from his 2 games shooting slump, which seemed like a minor disaster on Twitter. So Nirav, when we talk about getting athletes back, what do you look at? Like, let's take ACL injuries, because I think that's the classic one that we all know the same time frame. What do you look at in terms of making the decision a kid can play or an adult can play in terms of clinical time, et cetera?
Yeah, no, I think there are various components of it. I think number one, you're looking for, biologic healing. We know pretty well in studies when things should heal, internally. And I always like to tell, patients, there's the internal healing that you necessarily can't control. I mean, you can make it go wrong, but in general, you can't speed that up. So for an ACL, we're thinking right around 9 to 12 months, we know biologically the graft is healed. And then you're looking at clinical exams. I mean, do they have muscle strength? Does the ligament feel stable? But then I think the most important part, and I think this is where professional athletes and our weekend warriors or everyday athletes kind of vary, is that functional process. Is that, for a lot of times these athletes to get back to that high level, it's how they're looking in terms of their balance, how do they look in terms of their coordination. And what I think gets forgotten a lot is confidence that each individual athlete has in that. And like, everyone can get to the point where they have strength, they have balance, they look great in physical therapy, but when they go out in the game, they're fearful. They don't want to do these movements that really can cause them to have an injury. So, I think probably, speaking of Klay yesterday, the one time in the game where it really, showed that he has that confidence, we went up in the lane and dunked. I mean, you talk about coming back off a major injury, driving in the lane, doing something you don't typically do, and then not knowing how you're going to land. I mean, I think that really exemplified how confident his field and how great the Warriors medical staff did in terms of his injury recovery. And that's something each individual athlete, the ones that we're taking care of in our clinic, we try to stress. It's about being confident in your leg and all the rehab you've done over the past several years.
Yeah, I'm still waiting for my next game, but I'm waiting till dunk first, and then I'll go back to playing pickup basketball. So Drew, as our expert on imaging and advanced imaging modalities, why not just get an MRI post-op and say, okay, well, now your graft is healed enough or your Achilles is healed enough? Is MRI really helpful?
Yeah, I'd say at this point, not really. It's something that we're working on to try and be able to say, can we analyze it in a way that, has meaning and predicts if people are safe to return, but not really there yet. And then so often too, the structure can look good on the MRI, but then the athlete doesn't have muscle strength, doesn't have control, doesn't have, that protective ability. And so much depends on like your quad strength, your hip strength, and then how those are all working together. And so if you say, okay, sure, the ACL looks good, but like they have no hip strength, they're going to be at huge risk for re-injury. And so it's just you have to factor in all those points. And at this point, we really don't use MRI that much to check on the graft. We're usually, using our physical exam and saying, that ligament feels good. Hopefully we can get to a point where we can evaluate it well without, or with, advanced imaging to be able to say if people are ready a little bit earlier than what we wait for now. But that one still to be seen.
Yeah, I think one of the really nice series of studies that's come out in the last few years is asking patients essentially a return to sports questionnaire and how they feel about it. And the crazy thing is how they feel about it actually predicts whether or not they're going to get re-injured. And if you take a step back and think about it, it kind of makes sense. If your knee is not feeling perfect, especially for a higher level athlete that's going to sense that, your knee's going to tell you you're not ready to go back. So what I try to counsel my athletes that if you don't feel ready, that is your body telling you you don't feel ready. And we need to continue to work on some conditioning and strengthening and core work until you feel ready, rather than just saying, well, you're at 8-9 months, let's get you back. So we all know that there are times that athletes come back too soon. So especially with Klay, when you look at this, which for all intents and purposes looks like it's been slow, methodical, Instagram worthy, what are the risks when an athlete comes back too soon, and what are the benefits for really taking the time? First, Nirav, what do you think?
I think obviously the risk is if the area is not, biologically healed, you can re-tear it. You can re-tear your ACL, you can re-tear your Achilles. So I think those are issues first. So once that kind of time frame is made and we're pretty confident that the structure is healed, it's about that function. And I think what can happen is if an athlete comes back and they go back into playing 35, 40 minutes a game for an NBA player, or, having 80, 90 plays for a football player, there's a risk that other parts of your body aren't ready. The muscles are there, you're compensating. And you use a classic example of, someone like Kevin Durant, healed his Achilles, waited 18 months, came back, was playing huge minutes, and then subsequently was out for 2 months with a hamstring injury. So I think it's making sure that the body is ready to experience that load. Because even though you spent all this time rehabbing a general area, getting your strength back, you haven't actually done what everyone else has been doing, for that time you've been out, which is playing and conditioning. And it takes time to build that back. So I think it's preventing that secondary injury, and then hopefully not stressing that area that was healed from surgery and re-injuring that again.
All right. So last question, Drew, do you think it's a higher risk for the same body part or a different body part when athletes get back?
Good question.
Thank you.
I think the same body part will be the highest risk. Anytime you've had injury, an operation, it's never, quite the same as what we initially started with. So that will always have some re-injury, but especially when we see, athletes with ACL injuries, for instance, they are at increased risk of tearing the other side, the contralateral knee. And, something about them led to tearing like the left knee to start with, and they're going to have a higher risk on the right than somebody who's never torn it. So, I think that's one thing that we should always focus on during the recovery is not just limiting to like one body part that we're rehabbing, but making sure that maintaining good control on the other side, good strength, and good mechanics everywhere, so that when they are able to get back, they're not at risk for, those other injuries.
Yeah, no, absolutely. I think, Brian, you want to mention a little bit about some research in terms of ACL studies as well, too, and the risk of a subsequent injury, kind of putting this all in context for our audience.
Yeah, I think if you look at ACL injuries, what I tell my patients is if you're even with appropriate rehab, about 15% of people are going to re-tear their ACL. 15% of people are going to injure their other side. So it really is important to not only to get the injured side as stable as possible, but then make sure you're doing the same exercises for the other side, because if you're going back to a high risk sport, there was some movement pattern that put you at risk the first time, especially if you had a non-contact ACL injury. We don't have the same data for other sporting injuries like Achilles injuries, but at the same time, it makes sense if you're going to rehab everything and get as healthy as possible before you go back.
Yeah. One quick question before we wrap up for both Brian and Drew. I mean, one question a lot of people have is the role of bracing and taping and other things to prevent injury. I mean, we don't see Klay Thompson with an ACL brace. We did see Jimmy Garoppolo with taping on his thumb. What's kind of the difference in terms of using these when athletes do come back? Is it going to help prevent injury, or is it something that's just used in the acute phase to help control pain and stability?
Yeah, I'll go first. So I think taping or any sort of brace, especially in an acute injury, is going to limit the amount of excursion or the amount a joint moves. So that's going to decrease the amount of essentially energy absorbed into that area. It's going to help the thumb feel better. But long-term, especially for something like an ACL injury, a brace isn't going to limit the amount of twisting forces. There's no real way, unless we essentially drill things into bones, to limit that rotational torque. Where we see braces successfully in limiting injuries are when linemen in football wear braces to keep people from essentially landing on the outside of their leg and tearing the MCL or the ligament on the inside of their knee. It's not really going to be effective for rotational injuries like an ACL, although we'll often send patients back as they're transitioning into that. My graft is mature, I'm feeling really good, but I want to mentally feel as stable as possible, and a brace is helpful in doing that.
Absolutely. Well, clearly a lot of, go ahead, Drew.
Oh, and I think the other thing too is there are some sports where you can do it with the brace, but like, Klay wouldn't be able to cut and dunk and, do everything that he was able to do last night, like with that ACL brace. Like you can do some skiing, you can, other sports you're able to, still do with a brace on to maybe give a little support. But with what he needs to do, I don't think there would be a brace that would work out.
That explains why I can't dunk. Thanks.
Yeah, that's the reason. That's the reason.
Well, everyone, thanks again for listening to our podcast this week. A great time to be a Bay Area sports fan. 2 healthy players, hopefully moving on as we continue on the rest of the season. And we look forward to having you listen to our next episode. Thank you.